everyone. Before we begin today, I would like to acknowledge the traditional owners of the land we are on today, the Whadjuk people of the Noongar Nation, and pay my respects to elders past, present and future. Welcome and thank you for joining us today at this Australian Indigenous Health Infonet webinar, The Power of Stories, Navigating the Journey of Kidney Disease for Aboriginal and Torres Strait Islander People. My name is Gemma West. I'm a research officer with the Health Infonet, which is located at Edith Cowan University's Mount Lawley campus in Western Australia. I am joined by our director, Professor Neil Drew, who would like to say a few words before we commence today's webinar.
Thank you, Gemma. I would also like to acknowledge and pay my deepest respects to the traditional owners, elders past, present and emerging of the lands on which we meet today and of the lands from which you may have joined us. The Health Infonet is in the business of knowledge exchange. That is, ensuring that high quality information is made available to the Aboriginal and Torres Strait Islander health sector workforce. If information is to be of any value to an oftentimes poor workforce, it's crucially important that the information is timely, accessible and relevant to the everyday needs of that workforce. To achieve those goals in our webinar series, we partner with recognised experts such as our three wonderful guest presenters at today's webinar. Thank you so much, Kelly, Janet and Kate. And thank you all for joining us from throughout Australia. I know you will enjoy this webinar. Back to you, Gemma.
Thank you, Neil. I'd now like to invite our guest presenters to join me on screen. I welcome Kelly Owen, Janet Kelly and Kate Schwarzkopf. There we are. Morning. Kelly Owen is a Kaurna, Narungga and Ngarrindjeri woman and mother of 5. She is the Community Engagement Coordinator for the National Indigenous Kidney Transplantation Task Force and is a member of South Australia's Aboriginal Kidney Care Together team. With lived experience of kidney disease and transplantation, Kelly actively advocates for organ donation, community engagement and positive relationships between health professionals, patients and families. Dr. Janet Kelly is a nurse researcher who works collaboratively with Aboriginal community members, health and research professionals in urban, rural and remote areas. Janet has co-created a range of Aboriginal patient journey mapping tools and case studies that identify barriers and enablers to care in a range of areas, including kidney care. Kate Schwarzkopf is a research assistant who is passionate about using her privilege and skills to reduce inequity and racism in the healthcare system. Kate is completing an honours project which focuses on kidney health and ways to improve systems to better serve Aboriginal and Torres Strait Islander people. Thank you for joining me, Kelly, Janet and Kate. Aboriginal and Torres Strait Islander people experience an increased burden of kidney disease, more so for those living in remote communities. Chronic kidney disease among Aboriginal and Torres Strait Islander people is dependent on multiple factors, is multi-level and cumulative. Many of its risk factors are connected to social disadvantage and ongoing changes to lifestyle. Survey results show that the proportion of Aboriginal and Torres Strait Islanders reporting kidney disease has been consistent over the last decade, with the levels higher in females than males. The onset of kidney disease tends to be at an earlier age in Aboriginal and Torres Strait Islander people than for non-Indigenous people, increasing in age from early adulthood. If kidney disease is detected early enough, the progress of the disease can be slowed down and even stopped. Addressing the factors that lead to kidney disease can reduce its impact, requiring tailored, culturally appropriate prevention and management of programs, and even broader actions beyond the Australian healthcare sector. I will now hand over to Kelly Owen, who will kindly share her journey with kidney disease with us.
I'd like to respectfully acknowledge the traditional owners of the land that I tread upon. I pay respects to my Kaurna, Narungga and Ngarrindjeri ancestors and to all elders past who have paved the way, present elders holding the space and emerging leaders of the future. Our cultural practices, connections to land, seas and waterways are still strong today as they've always been. I pay my respects to other First Nation brothers and sisters with us today. Nanawe Michi Kelly Ari Owen, Napi Lewin Pombrook, Napi Naturtu Tadanyanga, Namawi Ninkui Tuni Paula Asham Jarian Isaiah Takari Karani, Mutha Yamalai Jarian Jr. Namawi Lakalinyari Owen Edwards May Adams Karnatu Kropinari Armstrong Kanawi. Namawi Pakanugana Naranga Mutha Naranjeri. Namawi Nangai Ted Tidswell, Namawi Ninkui Julie Owen. Marawi Mutha Nacho Lakalinyari Tamini, Anununi. My name is Kelly Owen. I live in Murray Bridge and my birthplace is Adelaide. I'm mum to 5 children, Asham, Jarian, Isaiah, Takari and Karani, and Mutha, Nana, to 1, Jarian Jr. My family bloodlines are the Owen, Edwards, May, Adams, Karnatu, Kropinari, Armstrong and Kanawi. My grandfather is Ghana, Naranga, and my nana is Naranjeri. My dad is Ted Tidswell, my mother is Julie Owen. I'm a mum, mutha, wife, sister, auntie, friend, and family member to many. I'd like to share my screen. This is the family that I was born into. I'm a middle child, and at a young age I contracted TB contact, and this laid the foundation for mistrust of doctors, nurses and the healthcare system. At 19, I was actually diagnosed with chronic kidney disease and had already had my first child. Throughout my journey, I had plenty of urine samples with my pregnancies, which always showed blood and protein plus. With my last child at age 30, I had a biopsy which already showed that I was at 30% and at stage 3B, so was nearly at stage 4. Lots of new changes happened in my life and I reconnected with my high school sweetheart, Jeffo, and his mum, Pat Kruger, was my other mum. She'd been diagnosed with CKD and been on dialysis for 11 years. She was my emotional support with first-hand understanding of what I was going through. The best advice she gave me is that I was going to be the biggest advocate for myself and I had to speak up. Mum passed away 3 years ago at age 62, way too young. I tried peritoneal dialysis, but I had 3 bouts of peritonitis. And so I marched myself down to the hemo ward and I asked to be started because I'd already had a fistula put in. But I did have blowouts and I wasn't really told about this until my second session. So some of the advice that I can give is that you need to do your research around treatments and the risks and the benefits for you. Throughout my journey, I recreated my own DX form and I journaled my way through my whole kidney journey. I recorded everything and anybody who touched me. I was working full time with my youngest 2 still in primary school. So we would taxi down from Murray Bridge, where I'm living, down to Adelaide, which is about 85 k's, 3 times a week for treatment, as I didn't have any local chairs on country and available to me. Issues with this was transport and funding. And this really started my advocacy in the renal space. I was approached by our head of unit, Professor Toby Coates, to speak with the Adelaide Advertiser around organ donation and appear in the newspapers encouraging families to have these really hard conversations. I'd speak at Donate Life, with Donate Life at teacher conferences and spread the word of how important it is to donate organs and to have these conversations before we get to our sorry time. My workup wasn't done in isolation. I had a team surrounding me. Jo was my case manager and she worked with the CKG. Her advocacy and knowledge of the health system helped me immensely because she was also a nurse. My local Aboriginal Health Service, Marundi, was able to help me coordinate transport until I had a chair based up here in Murray Bridge. Having a support team outside the family is critical for everybody, especially for me. I had lots of ICU admissions and it definitely wasn't a smooth ride. I had a calcium deficiency, so I had to have a parathyrectomy. My families on both sides who approached the health system was told that they couldn't donate a live kidney, and it took away their self-determination of having, being able to give me a life-saving gift. And this infuriated my family as they were healthy and they didn't have any pre-existing health issues. It was definitely a roller coaster of rides. During this time, you really needed to be able to stay positive and keep your mind and body as strong as possible. And one of my ways was to record my kidney journey. I'm very fortunate to have had this long-awaited call that everybody waits for once we get on the active list. Mine came at 11:37 on the 25th of May 2016. Dr. Shilpa, who's actually pictured with me, isn't my nephrologist, but she's the one who gave me the phone call and explained to me that this organ was going to be harvested from New South Wales and be transported to Adelaide. And I should be expected to be on the operating table the next day by lunchtime, and I was. So the 26th of May, the National Sorry Day, is actually my thank you day to the donor and his family. As I was wheeled away to the operating table, I'm worrying about my family was worrying about me. I'm very fortunate to have an older Tedder, Kim O'Donnell, who supported them and opened the communication lines between the hospital professionals, as there really wasn't a clear and ongoing information being fed back and forth on my progress. And I'll forever be grateful of having someone there to advocate and support my family during this scary time. Family. I have so much gratitude for everyone who was with me on my journey. They allowed me to recover and heal, from home-cooked meals to coming over to do my housework and supporting my youngest son, Karani, because he was only 12 at the time and he was my carer. And they allowed him to be a kid and really understood that he was taking on dual roles in the home. Nuncrease and alternatives really works hand in hand for me. I made sure that I had researched different ways of thinking outside the Western system, being with myself and my spirit and accessing these Nuncrease and working alongside the Western medicines to strengthen my body and mind and help me keep centered. All these methods worked for me. We talk about keeping our spirit strong. So how did I do it? Again, it comes back to my family. Having time for me, laughing, keeping connected to my body and my country, keeping in tune with what was happening within my body and my mind, and letting this help me guide my needs. The well-being. I love yarning, painting, creating earth arts, practicing meditation, lots of self-care, little things from facials to massages, but especially having Tedder time and listening to my music. On reflection of my journey, my biggest supports were my advocate, having access to education and understanding it at my level to help me make these informed decisions of what was happening in my journey, making sure I had plenty of rest and accessing bush foods regularly. So I've taken 12 months leave from my teaching position to be a part of the National Indigenous Kidney Transplantation Task Force. My role within this organisation is the Community Engagement Coordinator. I'm working with some amazing people across this kidney space. The biggest highlight is going out into community, speaking to other people with their kidney journeys. Pictured here is the hunting team in Darwin, and also other locals in Katherine. We'd get together and we not only share our journeys, but how do we move forward in this space? I'm actually organising 5 Indigenous reference groups across 5 hospitals. Prince Alfred in Sydney and Westmead, Sir Charles Gardner over in Perth, Royal Adelaide in Adelaide, and Princess Alexandra in Brisbane. From here, we really need to invest in the research. I really need to make sure I know my medications and what they are and what they're actually doing to your body. I'm going to be continuing to create my earth art designs with Miminar Maras Miwi and produce my Ngarrindjeri language resources to share for future generations. Anil Nuni, thank you all for listening to me. I'd like to now hand over to Janet Kelly.
Thank you, Kelly, for sharing your story. It's so important that our work together reflects and acknowledges the lived experience of Aboriginal and Torres Strait Islander people. I'll now share my screen. So I'll be discussing the overview of the Aboriginal and Torres Strait Islander kidney health update that we did. So this literature review was a collaborative project between the Health Infonet and the University of Adelaide, the nursing school. And also we've been advised and supported and received feedback from an amazing group of people who make up the Action Reference Group. So here in South Australia, we have a project called Action, Aboriginal Kidney Care Together, Improving Outcomes Now. And we have a really strong reference group of people with lived experience of kidney disease from across South Australia who've really helped guide us. Our update has included the research findings, what's happening with healthcare provision, and also drawing on the lived experience of people with kidney disease. So in order to make sense of what's been happening in the past 5 years, it's quite useful to look back at what's happened earlier as well. So if we look at the improvements that have been occurring that are specifically targeted on improving care for Aboriginal and Torres Strait Islander people across Australia, in around about the 1980s, there's been a focus on improving access to dialysis care in remote and regional areas. For example, in Darwin, Tiwi Islands, the Kimberley, Western Desert and Thursday Island. And this continues. In 2019, we had the first remote South Australian dialysis clinic in the APY lands of South Australia. There's also been a focus on providing mobile dialysis services, for example, the dialysis bus or truck in Central Australia, the Kimberley area, and in South Australia. And these have been initiated through a range of ways, through the Purple House, through the Kimberley Aboriginal Medical Services, and through SA Health. There's also increasingly been a focus on improving access to transplantation for Aboriginal and Torres Strait Islander people, and more of a national focus with the introduction of the National Indigenous Kidney Transplant Task Force that Kelly was talking about and plays that important role within. There's also been overall more of a national approach to improving kidney care and transplantation. Looking at the key research projects alongside the changes in clinical practice and in models of care, the research projects have been looking at feasibility for dialysis in rural and remote locations, starting back in 1985, with the hemodialysis in the Tiwi Islands, looking at improving communication and shared understanding, improving access to transplantation, and a better understanding of the progress of CKD for Aboriginal and Torres Strait Islander people through the EGFR study. There's also been a lot of research looking at people's experience of dialysis and their kidney journeys and how these could be improved and how models of care could be improved. There is also an increasing focus on working in partnership and how do we move towards co-design of new models of care with active involvement of Aboriginal and Torres Strait Islander patients who are positioned as experts in this area. They're experts of their own lives and experiences. There's been an ongoing and continuing focus on Indigenous governance and working in partnership. How do we work with peer support, patient experts across a range of different renal and healthcare services? Some examples are the Aboriginal patient expert and peer support groups in Darwin, Alice Springs and Adelaide, and the role of Aboriginal medical services such as the Kimberley Aboriginal Medical Service who've done so much work in their area. There's been specific activities of peer support, peer navigation for people new to dialysis in Darwin. There's been the teaching of dialysis staff about cultural awareness in Alice Springs. And increasingly, Aboriginal and Torres Strait Islander people with lived experience of kidney care are informing changes and improvements to policies, practices, models of care, and we're working on the new national clinical guidelines together, which have been very much informed by community consultations across Australia through Kidney Health Australia, Catching Some Air, and the Action projects. There are increasing numbers of reference groups and advisory groups, as Kelly was mentioning, and much more active involvement in decision making. Thank you. I'd now like to pass over to Kate. There we go.
Hi everybody, it's lovely to be speaking to you today. I'd first like to acknowledge the Kaurna people whose land I'm speaking to you from today, and extend my respect to all of those Aboriginal and Torres Strait Islander people participating in this webinar. So I'm just going to share my screen very quickly. There we go. So when thinking about chronic kidney disease in Aboriginal and Torres Strait Islander populations, it is important to consider context. Here we have a number of risk factors that contribute to the development of kidney disease. I'm just going to draw your attention to one example to explain the broader context of this risk factor. So let's look at low birth weight. Low birth weight reduces the number of developed nephrons, which puts an extra strain on the kidneys throughout their lifetime. In 2017, 13% of Aboriginal and Torres Strait Islander babies were born with low birth weight, and that's almost double that of the non-Indigenous population. We know that poor access to nutrition and maternal diabetes can contribute to low birth weight, and for many Aboriginal and Torres Strait Islander people, especially in rural and remote communities, food security and nutrition are major challenges. There have been reports of exorbitant pricing of food in community stores, particularly fresh foods are expensive, and because they are perishable, are sometimes not a viable option for people. So you can see that this relates back to the development of diabetes, cardiovascular disease, obesity, high blood pressure, and high cholesterol, and all of those are risk factors for the development of chronic kidney disease. The reason I say all of this is because sometimes these issues are approached from a position of personal responsibility and with a very biomedical focus. Not to say that the biomedical side is not important, but we must acknowledge the deep structural challenges that Aboriginal and Torres Strait Islander people face day to day that impact their health. So moving to the next slide. There is extensive research to show that access to culturally safe care for Aboriginal people is challenging. For example, many rural and remote patients have to relocate to access dialysis when they reach end-stage kidney disease. We found numerous studies describing the immense grief and loss that this causes amongst these people, who, when experiencing a serious and life-changing illness, a time when needing the most support, as Kelly showed us before, they must leave their families, communities, and country to receive life-preserving care. And you can imagine the impact that has on a person's mental health. Even when accessing care, there are problems that arise. In our review, we found many papers that discuss communication challenges between healthcare professionals and Aboriginal and Torres Strait Islander patients. Often healthcare professionals are extremely busy and don't have the time or are not given the tools or knowledge to best communicate with Aboriginal and Torres Strait Islander patients. If communication and trust isn't prioritised, Aboriginal people can feel very unsafe in the clinical environment, and communication breakdowns also lead to a decreased ability for patients to make informed decisions about their own health. There are a number of studies that pointed to patients not fully understanding their disease or treatment options. But I don't want to be all doom and gloom, because there are some great initiatives that have been implemented to address these issues. For example, the SA Health Dialysis Bus. So the SA Health Dialysis Bus has 3 dialysis chairs on board and travels out to rural and remote communities in South Australia with nurses from metropolitan Adelaide. This allows patients to visit their families, communities, and country without having to miss dialysis. The feedback from this program was overwhelmingly positive, with patients describing their relationship with the nurses improving considerably, as well as the joy of seeing their families and community being on country again. The nurses involved described the difference in patients' demeanour as night and day, that they'd never seen them so happy, and that they had a better understanding of their patients now. There are also mobile buses in Central Australia provided by Purple House, and in the Kimberley region by Kimberley Aboriginal Medical Services. There's also increased recognition of the important role that an Aboriginal and Torres Strait Islander workforce has to play in improving cultural safety and outcomes for Aboriginal and Torres Strait Islander patients. A number of key solutions have been identified through community engagement, such as the need for increased local and Indigenous workforce, including the role of patient expert navigators or peer support. Peer support can play a unique role in supporting newly diagnosed patients through their journey. In the Northern Territory, Purple House supports patient preceptors as part of the professional health service team. So there are some exciting things happening, and more of which are described in the report. Finally, I'll just quickly run through the future directions. So as Janet mentioned, there's the National Indigenous Kidney Transplantation Task Force, and that's been funded by the federal government and aims to address the inequity in access to kidney transplantation for Aboriginal and Torres Strait Islander people. There are newly emerging technologies such as the Automated Wearable Artificial Kidney, or AWAC, which is now in the human trial stage of development. There is an increased focus on primordial prevention, which refers to the avoiding the development of risk factors for a disease, as well as early detection and slowing progression of chronic kidney disease. As discussed, an increased emphasis on clinical and cultural safety will improve outcomes for Aboriginal kidney patients. And finally, an increased focus on Indigenous governance and co-design of new models of care will help to achieve clinical and cultural safety and improve equity in the health system. So that's all from me. Thank you. I'll just...
Thank you, Kelly, Janet and Kate, for that fantastic presentation. You all delivered a timely and very important message. We will now commence question and answer time. If you haven't already, feel free to ask your questions now in the Zoom Q&A box, or email your questions to the contact details that I'm about to place on screen. Okay, so we have a couple of questions that have popped up already. So Naomi says, awesome story, Kelly. Thank you for sharing. I understand that there are still very low numbers of Aboriginal and Torres Strait Islander people having kidney transplants when many could benefit. I'm wondering what your experience has been talking to other Aboriginal and Torres Strait Islander people about transplants and what the response has been. Kelly, I just invite you to unmute yourself and pop on your video if you'd like to respond to that question.
Hi, Naomi. Thanks for that. There's lots of discussion around transplants of why we're not being worked up as quickly as we could be, matching and understanding how we're matched with another donor. Also access of being able to have our transplant and recover. So there's been lots of conversations around what's happening in the transplant space. Thanks for your question.
Thanks, Kelly. Rachel has said, great presentation, everybody. Are we able to get copies of these slides and will the recording be available? Yes, Rachel, the recording will be available shortly and the slides will be available online as well. You have also asked, Rachel, is the systematic review available online? So that's something that we're at the final stages of putting together at the moment, and there'll be plenty of promotion when that is available. The next one says, thank you both for intimate and research insights. Carla has said, thanks everyone, great presentation. Question for Kate, what is currently being done to increase prevention and early detection?
Hi there. This is a little bit hard to measure or find based on stuff specifically targeted at kidney care because often these sorts of things are coming very, very early. But there are sort of an increased focus on getting people tested younger. So for instance, in South Australia, there's the risk factor assessment and screening protocol, which it has been provided for doctors that advises them to test Aboriginal and Torres Strait Islander people much earlier than the general population for things like diabetes, kidney disease, and so on. And you know, around Australia, there are obviously, probably many of us know, a lot of health promotion activities happening, but because it comes so early, it's not always specifically targeted at kidney care.
Thanks very much, Kate. I'll just give it another moment to see if any further questions pop in. Doesn't look like we have any further questions. As I mentioned before, our contact details are available on screen. If you think of something following the webinar, please feel free to email them through and we can pass them on to Kelly Kate or Janet. Before we conclude today, I would like to briefly take you to the Health InfoNet website to show you where the Kidney Health Portal can be found. Okay, so you can find the Health InfoNet website at healthinfonet.ecu.edu.au. Once you have landed on our homepage, the Kidney Health Portal can be accessed via our Learn menu navigation at the top of the page in the Health Topics section. Once you have arrived at the Kidney Health Portal, you may browse publications, resources, programs, courses, events and jobs by scrolling halfway down the page to these icons visible on my screen now. Lastly, you can connect and share with others in the field of kidney health by using our new Health Info Chat feature. Health Info Chat can be found by clicking on the yellow tab on the right-hand side of the screen and finding the Kidney Health group. Just there. Beautiful. That concludes our webinar today. Thank you everyone for joining us and being a part of this Australian Indigenous Health Info webinar, and a special thank you again to Kelly, Kate and Janet for that great presentation. We really appreciate it. Bye everybody.